Hello everyone, my name is Leticia Malagon and I'll be talking about rheumatoid arthritis, what causes it, treatment options, and prevention tips. But first, what is rheumatoid arthritis? As defined by the Arthritis Foundation, rheumatoid arthritis is an autoimmune disease in which the body's immune system, which normally protects its health by attacking foreign substances like bacteria and viruses, mistakenly attacks the joints. Our textbook defines it as a chronic autoimmune disease characterized by inflammation of the joints, stiffness, pain, and swelling, which result in crippling deformities. An abbreviation, which I'll be using throughout these slides, is going to be RA. Next, I'll be talking about rheumatoid arthritis. There are about 200,000 cases of rheumatoid arthritis. 70% of those cases are women. Rheumatoid arthritis usually starts in middle age, but can also affect children and young adults. It is the most common joint disease amongst older people. Rheumatoid arthritis mainly affects people between the ages of 19 and 60 and older. Most rheumatoid arthritis medications have side effects, just like with any other forms of medications. Not only does it affect your joints, but it affects the rest of your body too, and I will go into some detail about that. Next, what does rheumatoid arthritis look like? On the left, we have a picture of what normal joints look like and what rheumatic joints look like. As you can see, RA causes the immune system to attack joints and wear them down. Rheumatoid arthritis also causes the joints to become deformed. On the right, we have a patient with progressive rheumatoid arthritis. As you can see, the joints have become severely deformed with swelling at the wrists. So, what causes rheumatoid arthritis? Well, researchers do not know the exact cause of RA. But here's what we do know. There are certain genes which put people at an increased risk for rheumatoid arthritis. The main one is a gene called HLA, which means that people with this gene have a greater chance of developing RA. Some other genes include the STAT4 gene, which regulates and activates immune responses, the TRAF1 and C5 genes, which are relevant to chronic inflammation, and the PTPN22 gene, which is associated with development and progression of rheumatoid arthritis. Some other factors include cigarette smoke, air pollution, insecticides, mineral oil, and silica in occupational areas. And then we have female hormones, which is why 70% of people with rheumatoid arthritis are women. Also, it has been found that obesity and the body's response to stressful events can also contribute to the development of rheumatoid arthritis. So, is there a cure for rheumatoid arthritis? Sadly, there isn't, but it can be treated. Here are some treatment options. There's self-care, which one can use a heating pad in order to relieve the pain and inflammation in the joints. One can also take non-steroidal anti-inflammatory drugs, which help relieve pain, reduce inflammation, and reduce fever. Some examples of NSAIDs are Celebrex, naproxen, ketoprofen, aspirin, and indomethacin. Some other treatment options include immunosuppressive drugs which reduce immune responses. Some of these drugs include Orensa, Humira, and Trexall. Some of you may have heard of Humira from television commercials. Another is anti-inflammatory drugs, which prevents and counteracts swelling in the joints and tissues. An example is azolpidine. Another is steroids, which modifies or simulates hormone effects, often to reduce inflammation, or is used for tissue growth and repair. Some examples include cortisone, prednisolone, and methylprednisolone. Some of the other treatment options include therapies such as stretching and physical therapy. A medical procedure which can be used to help with rheumatoid arthritis is arthrocentesis, which uses a syringe to collect fluid from the joint, also called joint aspiration. Lastly, there's surgery. Some of these surgery options include arthroplasty, which is a surgery to repair or replace a joint, and joint replacement, which involves removing a damaged or defective joint and inserting a new functioning one in its place. Can RA be prevented? Sadly, the answer is unknown, but once you're diagnosed with it, there are lifestyle changes that you can make in order to ease the pain or slow down the progression of the disease. Diet and exercise are usually the best lifestyle changes that one can make. Well, what are some diet changes that you can make if you're diagnosed with rheumatoid arthritis? First off, you can eliminate processed foods and most grains from your diet. Consuming animal-based omega-3 fats can also help. Also, you will need to take vitamin D. Eating food as raw as possible is also recommended, as well as juicing. Some natural pain relievers include turmeric, boswellia, and ginger, all of which have anti-inflammatory properties. Well, we have come to the conclusion of my presentation. I hope you all enjoyed it, and I wish everyone a great summer.